We're going to go and start with our second part of this lecture, which is the next form element that we're going to hit on, leukocytes. So leukocytes, also known as white blood cells, are the only formed element that's actually a complete cell, which means it has organelles, and most importantly, it has a nucleus. It makes up less than 1% of the total blood volume. So on average, you're looking at 1,800 to a little over 10,000 white blood cells per microliter of blood. It functions, its main function is in defense against disease. White blood count cell that's over 11,000 per microliter is what's known as leukocytosis. So that's high level of white blood cells. And essentially, when we're talking about that, we're talking at the idea that there could be some sort of infection, right? And leukocytes are grouped into two major classes. They are known as either granulocytes or agranulocytes. And so if we look at this picture here, you get a good idea of the two. So basically the granulocytes are the ones when we go and we stain them, they contain visible cytoplasmic granules, right? And so you can see the little dots in there, and they're different colors based on the dyes that we use, right? And agranulocytes mean that they do not contain visible cytoplasmic granules, right? And then you can see here when they're dyed, you can't really see any dots in there, right? Versus in the granulocytes. So we're going to go over each form or each side, and they're subdivided. The granulocytes, you'll notice, are neutrophils, eosinophiles, and basophiles, and the agranulocytes are lymphocytes and monocytes. So we're basically going to review over these and talk about what each one does. Now, when we go and form this out, now that white buffy layer that we talked about earlier, that was less than 1%, right, is this area that's right here. And so if we take this out and do a differential white blood cell count, what we're actually looking to see the percentages here. You can see the normal concentration that you got and essentially the percentage. So 50 to 70% of them are neutrophils, right? So you can see there's a big chunk of those there. In density, the next you can see that's laid there is the eosinophils, and those are between 2 and 4%. The basophils are right here. It's less than 1%. And so those are all the granulocytes. And then when we go into the agranulocytes here, you can see this one, which is the next most numerous, is the lymphocytes, which is between 25 and 45%. And then this bottom area, that's the monocytes, between 3 and 5%. And so when you're looking at the most at numbers is neutrophil, then you have lymphocytes, then you have monocytes, then you have eosinophiles and basophiles. And if you remember, the eosinophiles and basophiles were much harder to find than even the lymphocytes and the neutrophils. And so a really easy way that you can remember these in terms of how many they have is never let monkeys eat bananas, right? Neutrophils, lymphocytes, monocytes, eosinophiles, and basophiles will tell you, and the different combinations. So let's start talking about what each one does here, right? And so the granulocytes, there's three types: the neutrophils, the eosinophiles, and the basophiles. They're larger and shorter lived than red blood cells. They contain lopes rather than circular nucleotides, and they're all phagocytic to some degree. And so phagocytosis means that they can engulf their prey, if you want to put like a little when we want to compare prey to basically bacteria or a parasite or a virus or something like that, that it's going to get rid of. So neutrophils. These guys are the most numerous, and you can see the granules. And these granules that you can actually see within there, they have what are known as hydrolytic or antimicrobial proteins. Hydrolytic enzymes, if you remember hydrolysis from part 1, and we talked about this a little bit, it means that lytic means to tear something apart, and hydro at the beginning is talking about water. So they're going to do these reactions to basically tear things down. And so they have either hydrolytic enzymes or defensin, which is antimicrobial proteins. You notice here that they have this kind of pinkish area right there, and then the nucleus is lobular. So you can see here you have a lobe here, a lobe here, and a lobe here. And so you have, in this example, 1, 2, and 3 lobes. So these guys have anywhere from 3 to 6 lobes, and that's one of the easiest ways to identify those. They're very phagocytic, which means they are bacteria slayers, and they kill microbes by a process called respiratory bust. And so basically what these guys do is they synthesize potent oxidizing substances, equivalent to something like bleach or hydrogen peroxide. And basically these molecules here, defensin, merge into these big kind of vessels, or these vesicles called phagosomes, and they form these spears with these molecules that pierce holes in the membranes of the ingested microbe, the microbe that you bring in through basically these antimicrobial proteins, and these oxidizing agents and hydrolytic enzymes all work there. So it's pretty kind of devastating. Now these guys are also known as polymorphonucleates. Oh my gosh, sorry. And they're called that because poly means many, and morphology, along with nucleus, means that their lobes can look different. And that should be apparent considering that they can be anywhere from 3 to 6. So they can kind of look a little bit different. And these, on average, are around about 12 hours. Basophils. These... Sorry, skipped one. The eosinophils, these are very short number. There's only about 2 to 4% of these, and they essentially have this pink color to them. Now these are bilobal, which means that there's only 2 lobes in here. So if generally you see something that's 2 lobes, you're going to look at an eosinophil. And if you notice, it's very pink in nature. It's because this is positive or reacts with an acid stain that's pink. And so this kind of looks like earmuffs, right? And within these red stain granules, there's digestive enzymes in here. So they release those digestive enzymes on really large parasitic worms, and it helps to digest their outsides, right? They're also important in playing roles in allergy and asthma, as well as immune response regulators. Now these guys can work together or assist the next guy, which is a basophil. These are the rarest of all the red blood cells. White blood cells, sorry about that. And it accounts for less than 1% of all leukocytes. And these guys, you can tell they are bilobule, but a lot of times they're hard to see because you have this dark purple stain. This is more of an alkaline stain here. And basically it contains these purple dots are these large granules that contain histamine. And so this is an inflammatory chemical that acts as a vasodilator and attracts other white blood cells to this site, right? These guys also release heparin, which is basically a blood thinner. And a lot of times these are the guys who make you cough and sneeze. We're not always so happy about them, right? And the eosinophiles work with these basophiles in response to allergic reactions. Now we're going to get into the agranulocytes, and these guys are the largest of all leukocytes, are these monocytes, and they have what's known as a kidney shaped. So they don't have that really thin area in the middle. They look like a big kidney right there. And they tend to have this bluish color to them. Did that move? I think it's going. I'm sorry, guys. This guy is, for some reason, it keeps going through stuff really quick. So the agranulocytes, essentially, they're both spherical in nature on the outside, and the nucleus is either going to be spherical or this kidney shape, right? And they lack visible cytoplasmic granules. It doesn't mean they don't contain them, they just don't, oh my gosh, stain. And so when we look on here, we're going to look here at the lymphocytes. These are the second most numerous. They count for about 25% of all of them, and they're mostly found in lymph node tissues. Example, lymph nodes in the spleen, and a few are circulating in the blood. They're crucial to immunity, and there are two types here. There are what are known as T lymphocytes, which are also for short T cells, and B lymphocytes, which are also known as B cells. The T cells act against virus infected cells and tumor cells. And the B cells give rise to what are known as plasma cells, which will later produce antibodies. And so these are extremely helpful to and part of what we will later learn about the lymphatic system. And the monocytes that I started talking about a second ago, this is the big kidney shaped one. It's the largest of all leukocytes. It's about 3 to 8% of them. It can actually leave the circulation and enter tissue and differentiate into macrophages, and what that means is turn into them. And so they're very active phagocytic cells. They're crucial to protect against viruses and intracellular bacterial parasites, and they're responsible for, when you look at chronic, or they actively or respond to chronic infections. And so they help to activate lymphocytes to mount a kind of this cohorted immune response. And so those are our different types of leukocytes. Now, when we actually go and make leukocytes, it's known as leukopoiesis, and that's a production of white blood cells, and it's stimulated by two types of chemical messengers that come from red bone marrow and mature white blood cells. It's interleukin, and so these are normally numbered. So if you look at them, you might see IL-3 or IL-5. Those are examples of interleukin. And then you also have what's known as colony stimulating factors. And so they are named after the type of white blood cell that they stimulate. So you might see basically granulocyte CSF that helps to stimulate granulocytes. And so all leukocytes originate from the hemocytoblast cells. Remember, those were the cells that we started with when we had the erythropoiesis. And then they branch into two pathways. Those pathways are either the lymph node stem cells or the myeloid stem cells. And that is going to basically determine if they are going to be agranule, including the monocytes, or if they're going to go into lymphocytes. So the lymph node, oops, sorry guys. The lymph node is going to make lymphocytes, and then this myeloid, as you know, are all others. And remember, the myeloid stem cells are essentially the stem cells that start with erythropoiesis as well. So let's look at the production here of leukocytes. So if you notice, we have this hematopoietic stem cell here, this hemocytoblast, and this guy, as you can see, has the nucleus and it's dividing. And so as it divides, it's either going to go and become a myeloid cell or a lymph node stem cell. And so once you have the myeloid, and so we're going to start on this side here, that myeloid stem cell is going to make all the granulocytes along with the monocyte, okay? And so they arise, once we have this myeloid cell, basically it divides and it changes into a myeloblast, if you see here, right? Now, on the other side, both of these are myeloblasts, and here you have a myeloblast, but here you have a monoblast. So these three this way are going to be the granulocytes, and these on the other side this way are the agranulocytes. So the myeloblast will continue to change and differentiate here into what are known as the promyelocytes. And so in these, you're going to get an accumulation of lysosomes. And if you remember, lysosomes are there to help. They hold hydrolytic enzymes that can essentially help to break things down. Now, each one of these, depending on the type, at this point, once we reach here and down, they're committed to whatever it is that they're going to end up being once they're past that myeloid stem cell stage. So these myelocytes are going to start accumulating granules. And from there, the band cells will start getting these nuclei that forms these curved arcs. Basically, these changes. And basically, once they become these mature granule leukocytes down here, this is going to be once the nuclei get segmented, you can start seeing their bilobal or multilobes, right? They're going to be released into the blood. Now, if we start looking at the other side, or let's kind of look at the monoblast, right, which is right here, the monoblast is going to change into the promonocyte and then the monocytes. And so they share a common precursor up here. Oops, sorry guys. They share a precursor cell up here with the neutrophils, right? But it does differentiate into its own right? This guy's a little bit different. Those minor changes mean that this guy can live for several months. The rest of these white blood cells have a much shorter lifespan than red blood cells. Now let's look at the lymph node stem cells over there. They're a little bit different, right? So you can see here they go into what's known as a lymph node stem cell, and then when they divide and they become committed cells, they are going to be a combination of either B lymphocyte precursor or T lymphocyte precursor. And so these guys, whenever they become basically, they start becoming more mature. They are going to become mature in the T is going to become mature in the thymus. And the B will become mature in the bone marrow. And I remember this because the B, bone marrow starts with B, and the T, thymus starts with T. So basically they get made in the same area in the bone marrow. The difference is the B actually becomes mature there, where the T lymphocytes move to the thymus and become mature there. And lymphocytes can live for a few hours, 2 decades. So it just depends on the cell itself. And so that's how leukocytes are made, or what's known as leukopoiesis. Now, many different hormones such as EPO and CSF are used clinically, and they can stimulate bone marrow of cancer patients receiving chemotherapy or stem cell transplants. They're also used to increase protective immune responses for patients who have AIDS. So being able to activate and make more of the cell types are very, very important. And so when we're talking about leukocyte disorder, you have leukemias. And leukemias are basically cancerous conditions that result in an overproduction of abnormal white blood cells or leukocytes. So they cannot function correctly. So you end up getting what's known as abnormally low white blood cell, which is leukopenia. And essentially, go back here, right? And so leukopenia is the idea of you can tell if it's less than about 5,000 white blood cells. And this can be due to things like viral infections that are killing or destroying all the white blood cells, or heavy metal poisoning. Sorry, it keeps going forward. So overproduction can rise from leukemias or infectious mononucleosis. Leukopenia is an abnormally low, which is the opposite, right? And it can be drug-induced, particularly by anti-cancerous drugs or glucocorticoids. If you are abnormally high, is a process called leukocytosis, and that is when you're over 10,000. Right? We talked about this. And this can be due to bacterial infections, dehydration, vigorous exercise, or emotional disturbances. So let's go back and talk about leukemias a little bit more. So this is due to an overproduction. There's acute, which is quickly advancing leukemia, and these are derived from stem cells. This particularly primarily affects children. Chronic or slow advancing leukemias involve proliferation of late cell stages. This is more prevalent in older individuals. All leukemias are fatal if they're not treated. Essentially, immature non-functional white blood cells end up flowing into the bloodstream. Cancer cells fill red blood marrow, crowding out all the other cells, and this is going to lead to excessive bleeding or anemia. Death normally comes from internal hemorrhaging or overwhelming infections. So most of the time when people are dying of a leukemia, it's not directly a effect of the cancer killing them, but the body shutting down and letting other things kill them due to what the cancer is doing to their body. And so treatments are radiation, anti-leukemic drugs, and stem cell transplants here. Infectious mononucleosis, or otherwise known as mono, is highly contagious viral disease. It's known as the kissing disease because it's usually seen in younger adults. You can say in your late teens to early 20s. By the time you're in mid-age, about 94% of people have been exposed to Epstein-Barr virus. Most people get Epstein-Barr virus, believe it or not, when they're younger. It ends up looking like it's a normal cold symptom, right? The problem is as you age, your body becomes less adept at dealing with it. And so the problem with this, it results in a higher number of typical agranulocytes. So it involves lymphocytes that become extremely enlarged. They used to think it was monocytes, that's why they called it mononucleosis, but it actually involves lymphocytes here. And you can tell if you have mono because basically what happens is you become extremely tired to the point where you cannot get out of bed. You hurt all over, you will have a sore throat and a low fever, and you're just kind of really achy and tired. And it runs its course anywhere from 4 to 6 weeks is on average. Like I said, people think of it as a kissing disease because when you get to where you're in your teens or early 20s, you're kissing, but you can get this from drinking after someone. You can get this from someone who has it, who is coughing or talks and spits a lot, and you take it in. So it's highly contagious, and people can have it so that most of the time it's inactive in the body because it is a virus, and then for some reason it just becomes activated and so they can spread it. So it's pretty terrible, and the thing is not everybody who gets it essentially will have mononucleosis. Some people can take the virus pretty well, and like I said, you don't get it when you're younger. It normally materializes more into cold symptoms. And so this ends up coming into what's known as hyperplasia. And so it's basically you get increase in white blood cell division, and then anaplasia, which is you get weird cell structure that's not normal. And then a lot of times you have to be very, very careful with this because your spleen can rupture because you're clearing out so many cells that if you get hit, it's going to essentially increase in size, and you can damage yourself or hurt yourself if you get hit in the stomach or kind of in that area. So that's why it's really important not to do any kind of physical activity during this, or do anything that can cause you to get hit in that kind of trunk area really hard where you can rupture your spleen. Okay, so the last part of these that we're going to talk about are platelets. but we are going to wait for the platelet part after this break. So at this point, we'll see. I will talk to you guys soon.